Listen, I've only got like 10 minutes or so to say a few things, and the most important two things I want to do is, first of all, welcome you all to my hometown of Hobart, the most southern capital, the best capital, the real jewel in this nation's crown. And I know you've come from all over Australia, so to delegates, VIPs, sponsors, anyone else who's in the room, thank you for coming, and I hope you have a lovely few days here at the conference. The other really important thing I want to do is say thank you. I think I have a clear understanding of the importance of primary health care excuse me, in this country, and of the importance of primary health care nurses in particular. Often it's, when we talk primary health care, it's often the general practitioners who probably get all of the limelight and the public profile and are in the debate. But I'm very mindful there's, for every GP, there's 2 primary health care nurses in all sorts of things, everything from the jails to schools to out in the community. And I'm very mindful that you are a very, very important part of the primary health sector. So to all of you, thank you. I also want to, they're the two important things I wanted to do. I probably could sit down at this stage, but you never stick a politician who cares about healthcare behind a microphone and expect him to sit down and shut up. I do want to acknowledge a couple of points. I do want to acknowledge the challenges you and your sector is facing in this country right now. It is not an easy gig, and I acknowledge that. For a start, there is enormous reform going on in this country which is affecting many of you. We seem to be constantly in a period of reform when it comes to mental health, and of course the federal government is still working on its latest national mental health plan. We are, well, a few years, I suppose, into fairly deep reform of the aged care sector, and of course we are dealing with the implementation of big reforms in the disability sector with the National Disability Insurance Scheme and other changes. So, they say that change is one of the most unsettling things for people and for workers, and I know that many of you are dealing with change constantly in the area of your work and even in your workplace. Another challenge you've got is, I do think, and I lament the fact that in this country, primary health care remains underrated. And that's staggering I mean, we all know the value of primary health care. You all know the value even better than me. But yet I think it is underrated, and there is an underinvestment. I am struck by a comment from Dr. Margaret Chan, the Director General of the World Health Organisation, several years ago, when she said, "A primary health care approach is the most efficient, fair and cost-effective way to organise a health system. It can prevent much of the disease burden, and it can also prevent people with minor complaints from flooding the emergency wards at hospitals. Decades of experience tell us that primary health care produces better outcomes at lower costs and with higher user satisfaction." That's not a bad summary, I reckon. And maybe I should run off 150 copies of that and shove it on the table in front of every federal MP. I'm certainly tempted. Who's heard of Professor Michael Marmot from the UK? Yeah, a very famous global health professional. I'm in the process of reading a book of his called The Health Gap, which looks at really many of the social determinants of health. And I'm tempted, if I could afford it, to buy 150 copies of his book and shove that on the desk in front of every member of the federal parliament. So I think there is a lack of awareness among policymakers and lawmakers about the value of primary health. That is reflected, of course, in the level of investment. The figures, the latest figures I've seen, about 7% of public funding in health goes to primary health care. And I think that is a very, very low figure. And if we were to spend more than that 7% on primary health care in this country, we'd be saving a lot of money elsewhere, and in particular in the tertiary sector, the hospital sector. The other area, and this is not unrelated, of underinvestment is, of course, in wellness programs and so-called preventative health. I've never understood why they call it preventative health. It's an illogical term, isn't it? I prefer to use the term wellness. Hard to get a handle on the exact amount of money we're spending on wellness in this country, but maybe 2 to 3% of public money that's going into healthcare is going into wellness. So 2 or 3% into wellness programs, maybe 7% into the primary healthcare sector, a total of about 10%, even though that area of investment is arguably the most important area of investment for public funds in healthcare in this country. And if we were to increase that just a little, we'd probably save an enormous amount of money with our hospitals and in other areas of expenditure in the community. Excuse me talking a bit too much about wellness at a primary healthcare conference, but it's a bit of a passion for me. Again, it's hard to get a handle on the exact figures, but I think a reasonably reliable figure is that for every $1 spent on wellness, you'd probably save about $5 in the health budget. But politicians aren't good at investing to save, and I think that helps to explain why we are under-investing in that area. That's about all I want to say. I was only given 10 minutes, so it's very much a case of saying, welcome to Hobart, thank you for what you do. Me and others in Canberra are friends and allies of you and of your sector. We acknowledge the importance of what you do. The challenge is to find the funds in Canberra to invest more in what you do. I'm very mindful, and I believe you had Ken White, one of the ministers, spoke to you yesterday. He came and spoke with me and a group of aged care service providers yesterday afterwards at a separate event. And when he was talking about the budget challenges facing the federal government, I couldn't help myself, and I made the point that we do live in one of the richest and most fortunate and most clever countries in the world. Our federal budget is in the order of $400 billion a year. That's $400,000 million a year. Do you get your mind around that? $400,000 million a year, or thereabouts, just spent by the federal government. So that doesn't include local and state government spending. I think with the right priorities, we can have the world's very best healthcare system, the world's very best aged care system, the world's very best support for people with a disability, the world's very best care for those with a mental illness. You know, the money is there. It's really all about priorities. And one of the challenges in Canberra is for us people in the Parliament to understand what the right priorities are, so we invest in that. And I made the point already, we're spending about 7% on primary health care. You know, that money is paying the wages for many of you. I think we could spend a lot more than that, and we would have a much happier, healthier community. And I think we would have a budget in much better shape. That's all I want to say. So thank you again. I hope you have a great couple of days. You do have allies, and I'm really delighted that you now have a professional organisation. I'm told it was formed about 15 years ago. You cannot afford to not have a professional body representing you these days. So much of what goes on in this country when it comes to determining what the priorities are in Canberra and where the money will be spent and how much of it will be spent, these are political decisions. So you need to be politically active, starting with having a well-organised professional body, which you now have, and you being members of it and supporting it and coming to events like this and learning more about your sector. Any group of professionals in this country now who doesn't organise yourselves like that and become part of the policy debate, you will be left behind. So I know events like this are as much a social event and catch up with friends you haven't seen since the last conference, but it's also a very powerful expression of the solidarity and of the size and of the importance of the primary health sector, and in particular of the number and the importance of primary health nurses. There's about 70,000 of you. I think that's more than 10% of all of the health professionals in the country across all categories. Have I got that right? Or thereabouts? Thereabouts, close enough for government work. But, you know, about 10% of all health professionals in this country, you know, including doctors and allied health professionals, more than 10% are nurses. Half are nurses. Sorry, half are nurses. Half of all health professionals are nurses. But 40%. Thank you. Where did I get the 70,000 figure from? Primary. Okay. So okay. No, excuse me. Just rewind. So about 10% of all health professionals in this country are primary health nurses, and close to half of all health professionals in this country are nurses.
364,632 nurses and midwives in this country today.
But yet, remarkably, it is... Now, I've got a confession to make. My girlfriend's a GP. I'm going to be in such strife. But remarkably, it's the AMA and the College of GPs that lead the public and policy debate in this country. And I don't criticise the AMA or the College of GPs in any way for the important work they do. But when you look at the numbers, it really is the nurse community, including the allied health nurse community, which should be front and centre in the debate and driving the debate. So good on having an organisation to help you do that.
Thank you so much. Thank you so much, Andrew. Great to have you here.